taken for granted, and by extension, ordinary Ghanaians are going through suffering and predicaments that is no fault of theirs.
You said you're not happy with the posture of the employer. What about that posture are you not happy with?
Well, we have come to an agreement. We have signed these agreements and passed it into law. Let me put it out. So the onus lie on the employer to get it implemented so that it serves the individuals that went into that agreement. You have decided to push the whole agreement down, to push it. In fact, what they are even saying is that now they will not implement it this year, but next year, 2026. And it keeps ringing a bell in my ear. Is that how fair to treat nurses and midwives who have committed to breaking their backs to give the best of care to nurses, to the Ghanaian public?
So far, what sense are you getting from, because I'm sure, because as of yesterday, some executives were in that meeting with the ministry, also with the fair wages. What sense are you getting from them in terms of what your requests are?
I was in the meeting myself. The
Okay.
meeting was inconclusive with a proposal from the government side that we should call off the strike and then come back to negotiate. But what are we going to tell our members to agree to to call off the strike and then come back to the table when the proposal they are tabling is that our conditions of service should be implemented in 2026? We didn't have any concrete information to give them to agree to work. We explained all that transpired in the meeting to them, that the council was poised. There are 29 council members. Not a single of them voted that we should call off the strike.
You're saying the meeting yesterday gave you nothing to take to the council and make an argument for the strike to be called off?
Exactly.
Nothing at all.
What is at stake can be equivalent to nothing, because the conditions of service have been signed and we are looking for implementation, and it's since 2024. So if your proposal is that it should wait as we stand to 2026, then I don't know whether it is a good information enough for people who are on strike to resign their decision and then call off the strike.
Why are you insisting that this be done now?
Because it has happened in the past where we negotiated for conditions of service and it was never implemented. And it keeps getting our people impoverished. People were even bold to tell us that we have slept on our rights. We are not sleeping anymore. We are wide awake because our members are wide awake.
You negotiated conditions of services, condition of service in the past. It was never implemented.
In 2016, we had a negotiation, and it was signed into law. They kept saying they are going to apply it, they are going to implement it. Money is not there. They are making budgetary allocation, and it never got implemented. We were supposed to go for negotiation in 2018. Because of the effect of 2016, it affected even the leaders, because they felt whatever we negotiate for, they will keep backtracking. So we gathered momentum and negotiated in 2020. So if you realize, in 2020, nurses went on strike because of same conditions of service issue. And we are here in 2024 having the same issue. Are we going to continue to negotiate and employer after employer or government after government will say there's no money, so we can't implement it, whilst our cadre of health professionals continue to enjoy their conditions of service that has been negotiated and implemented?
What was the problem with the 2020? What was negotiated in 2020? Why wasn't it implemented?
There are sections of 2020 conditions of service that are still even in the conditions of service in 2024. We have the rural incentive allowance for our colleagues that are working in the rural areas. The government has agreed that it is important that we give some recognition and some help for our colleagues that are working in the hard-to-reach areas who, by virtue of they being there, lack some amenities, some family ties, and different conditions, and that they should be given some allowance as a motivation. It's never got implemented, and it's part of these conditions that we are fighting for.
And if you want implementation now, exactly what are you looking for? Because if in the past you've negotiated these agreements have been reached, they never get implemented. What were the challenges with those kind of conditions that made it difficult for government to implement?
We are not government, and we cannot speak for government, and we can't say it's because they have no budget or IMF or Russia, Ukraine, or COVID. That is not our stake, because we are looking at the negotiation team. The negotiating team is made up of Fair Wages and Salaries Commission, Ministry of Health, Ministry of Finance, for our part, with the stakeholders, that is the teaching hospitals. And before we reach an agreement, they take budgets into consideration. They take, the quantum of money that is supposed to be paid as allowances into consideration. So there is push and pull until we come into agreement. Whatever we table, they negotiate to bring it down to be able to pay. So when they are not paying, it beats our imagination.
And you never found out why they did not pay?
For 2020, we went on strike, so they managed to pay some of their conditions of service. They implemented a number of them. There were just a few portions that were not implemented because they felt those ones we needed to set to realign them. And we have brought them on board into 2024 negotiation. Same has been agreed, and some of these realignments has been fine-tuned. So we are looking forward to its implementation, only for the employer or the government team to tell us that the implementation should start from 2026, which is so unfair.
And what conditions would you call it of the strike?
When the team just agrees that they are implementing the conditions of service, we will call off the strike today.
You're saying that if government agrees today that they are implementing, you will call off the strike?
Exactly.
You will not compromise on the full implementation of the conditions of service?
We have made compromises in the past. We have made compromises even now. Even at the negotiating table, we made a lot of compromise. So why can't government also make compromises on our behalf?
I see. Is there a middle ground?
As we speak, we have put our proposal before them that if they are saying they have budgetary constraints, we are prepared to get the implementation started now, and whatever arrears is due us, we can stagger the payment. It will not be paid at once. We'll give them breathing space to be paying month on month or every other month to clear the arrears that is accumulating.
I see. Well, in the meantime, it's always said that it's bad labor, it's bad faith when you are negotiating with somebody and you're on strike at the same time. That typically, once you are sitting at the table, the best thing to do is to call off a strike and allow the negotiations. You always have that opportunity to go back and start the strike if they do not meet your needs. Is it not fair that since you are at the table, even if you're not happy with what is being proposed now, you go through with the negotiations and then decide whether or not it is fair to continue the strike? Would it not be fair to all parties on the table that you call off the strike while negotiating?
What is fair is for government to implement our conditions of service. We are no more negotiating. We are done with negotiation. When we are negotiating, that's when we look at bad faith and then negotiating in good faith. The name of the industry that does the negotiation is called Fair Wages and Salaries Commission. So what is fair is that after negotiation, steps are taken to implement that negotiation, not to renegotiate the agreement that has been reached again.
I see. Philemon, thank you very much for speaking to us.
Thank you for having me.
Philemon Japan is Assistant National PRO, Ghana Registered Nurses and Midwives Association. They said right now what is on the table, they've taken it to the council, and the council says no, that the strike should continue because there's really nothing really on the table that they can work with. Well, it's still a Gold Morning Conversation live on Radio Gold 90.5 FM. So the strike of the nurses continues. SM.